Maxine Bonta is one of my call handlers, so she's an emergency medical advisor in Coxheath EOC. She works answering 999 calls from the public and healthcare professionals and trying to provide advice to help people until the ambulance service arrives. I nominated Maxine for this award on the back of a communication that I received from a police constable who works in Maidstone. He'd attended a scene where a patient was collapsed. Maxine gave advice on how to give basic life support after a lot of probing to establish that the patient wasn't breathing. If it wasn't for the probing around the patient not breathing and the expert way in which Maxine undertook this, the outcome may have been different for the patient. The call in itself wasn't particularly straightforward. The police officer felt that the patient may have been breathing, and often on the telephone when you can't see the patient it's unclear as to whether a patient's breathing. They can take a few gasps, we call them agonal gasps, before they finally stop breathing altogether. Maxine correctly recognised this and started CPR at the earliest available opportunity, which is probably what helped the patient to be transported to hospital with a return of spontaneous circulation, so that's with their heart beating. This police officer, the wording in his email was, it was as if Maxine was watching him at the time, giving him instructions on exactly what to do next. Listening back to her call, that's exactly how it was. It was a very professional call, and it's undoubted that she had a part in saving this patient. I feel very proud. I feel proud of all of my team members when they do things like this, because they do this day in, day out. But the expert way in which Maxine delivered the advice that she did deliver on this occasion really did stand out. Sometimes we don't get things quite right. Sometimes the outcomes aren't as good as we'd like them to be. But on this occasion, it really was textbook.